So I think that we have reached the magic number of 30 participants, so we can start. Thank you very much. Welcome everybody. This is the last webinar of our series that we unmodestly called Change the World. We are very excited to have this final conversation because it has been a very interesting journey. We have had the opportunity to meet very interesting people from very diverse backgrounds and communities. And today we have the possibility of using a very diverse panel of experts to hear from them some reflections, some comments, something that we can use as let's say a sounding board to see if some recommendations and something concrete to further disseminate and move forward our proposals for global urban safety can be done. As you may know me already, I'm advocacy. I'm the chair of the Alliance of NGOs on Crime Prevention and Criminal Justice. It is an organization that is supporting the program of the United Nations on Crime Prevention and Criminal Justice, and that is coordinating a large number of members who share the interest of contributing to the implementation of this important agenda, which is one of the components of the overall UN agenda, and has important points of and interlinkages with many other different agendas. And the way we will proceed today, we will quickly go through say a summary of the key points from the work that we have done. So just to summarize for everybody to know what we have been doing so far, we had this series of conversations that were about urban safety systems and the stressors of COVID-19, and how civil society can frame an opportunity to build back better. COVID-19 has increased the impact of well-known stressors on safety, such as exclusion, vulnerability, inequality, inconsistent and mistrusted law enforcement, imbalance of power, and inadequate responses to vulnerability. In our series of discussions, we explored a model of urban safety that applies the lessons of COVID-19 to responding more effectively to threats to urban safety that pre-existed the pandemic. COVID-19 may have made problems more acute, but the potential for better solutions to problems and barriers that pre-existed the pandemic is becoming more clearly visible. Civil society also has a key role to play in driving this change. I would like to give the floor now to Emma de Villiers, who has played the role of rapporteur of our series of webinars, and she will take us very quickly through the key issues that we have been discussed. It's 4 pillars, 4 themes that we discussed through 4 different webinars. So Emma, the floor is yours.
Thanks very much, Anna. I'm very excited to be part of this conversation, which is really the culmination, as you say, of a series of discussions with a really diverse set of participants, expertise, insights, and so very exciting to be part of a truly systemic conversation. So very briefly, we started with a naming and framing where we said our first webinar really kind of laid some of the fundamental principles for the rest of the discussion. So we established that the city is the best locus for making decisions, planning and implementing interventions, and building networks to strengthen public safety. The concept of urban safety shouldn't be sectoral, but multidisciplinary and systemic, with consideration of progressive strategies and tactics which can create more sustainable safety impacts than some of the existing practices. We distinguish between urban safety outcomes that we want less of, such as crime and violence, and urban safety mechanisms we want more of, such as human dynamism, resilience, social cohesion, and participation. And we agreed that we need specific indicators to measure progress against these developmental, these moral type outcomes. We also discussed the notion that urban safety and peace start in the home. And this reminds us, as obviously the theme, one of the key safety themes that's been running through the pandemic is domestic violence and gender-based violence, that gender is also a very important lens that we always need to apply in our work in urban safety. And once we broadly sort of set the stage for a series of intersectoral discussions, we started to look in detail at specific aspects of urban safety practice, thinking through the latest learning, the opportunities and challenges presented by COVID-19, and how we might articulate a shared set of principles and tools to respond to specific questions about urban safety post-COVID-19. So the first sort of focused conversation that we had was on partnerships, collaboration, and integration to make urban safety possible. And we had a lovely conversation again with a diverse group of participants, where we agreed that when we accept that urban safety can only be achieved through integrated collaborative responses, it's necessary to innovate to better activate and sustain partnerships. This means commitment to more inclusive methodologies with more diverse participation, improved trust, and I think the real zinger there was the idea of real power sharing, which is often much more difficult to do in practice than it is to agree to do or to desire to do. We agreed that collaboration requires trust, listening, power sharing, removal of competitiveness, mutual benefit, horizontal structures. We said it's not about inviting people to the table, it's about inviting people to co-design the table, to make decisions together and to share ownership and commitment to outcomes that work for all, that benefit all partners. Without mutual belief in the competence and creativity of all partners, the democratic and inclusive notion of partnership won't deliver the benefits of collaboration and integration. So it's no good to simply say that we do partnership. We really need to share a belief about what that means. Different stakeholders bring different perspectives to shared systemic problems, and this is precisely what makes partnerships useful. Space should be created to embrace complexity, to allow for systems approaches to emerge through diverse perspectives, resources, capacities, and mandates. Difference is what makes partnership and collaboration useful. It's not easy to embrace, but without embracing difference, partnerships will not achieve any more than was achieved when we operated in silos. One of the key areas for shifting the nature of relationships and integration is law enforcement, traditionally carrying the primary burden for solving crime-related problems alone. So in the discussion that followed on police and policing in a system of safety, we looked at police mandates, capabilities and accountability, and acknowledged that they are currently under greater scrutiny than they ever have been before. Globally, emergency and disaster management plans were unprepared for the pandemic, and as a result, procedures and rapidly implemented regulations exacerbated the risks in many areas. As we develop our responses to future emergencies and as we think about the learning through COVID-19, we agreed that we need to be thorough and comprehensive in our planning. No sector can be left out, no sector can work in a silo, and no sector can work without the active participation of civil society. The future of policing lies in the understanding of the common ground with stakeholders and other sectors and disciplines to be complementary partners. This requires acceptance of loosening of hierarchies, in which law enforcement has typically been the most powerful and authoritative stakeholder in not only the provision of security services, but also more broadly in urban safety. Moving away from a language of crime and illness to a language of harm and reduction in the context of safety provides us with an opportunity to build a common agenda. So to kind of displace notions of crime prevention as being directly and primarily linked to law enforcement, but to situate law enforcement within a set of systemic responses. Mistrust, a lack of consequences, rights violations, and impunity lie across many failed attempts to build and sustain partnerships. And these have all really been highlighted under the conditions of the pandemic. Accountability internally in law enforcement agencies, to policy partners, local government, and to communities is key to successful prevention efforts through partnership programs. And of course, it's difficult to talk about accountability without creating difficult conversations. And so, of course, that also highlights why it's necessary for us to build relationships and partnerships on trust and mutual understanding and the idea of mutual benefit. Human rights frameworks have enormous value to offer in terms of problem solving and should underpin all of our efforts. And one of the concerns that was raised in the discussion about the police is that of mental wellness and trauma, and the impact that intergenerational trauma in communities, but also in the police, has on widespread police brutality, which we've also seen during the pandemic, which led us into the next conversation about mental wellness and resilience as essential to urban safety. In many societies, intergenerational and deeply entrenched trauma long pre-existed COVID-19. Communities have lived with interpersonal and gender-based violence, child abuse, and public violence, largely as a consequence of untreated mental wounding. Trauma and distress disrupt individual, interpersonal, institutional, and societal functioning and perpetuate a cycle of unsustainable development. COVID-19 casts a harsh and unforgiving light on the burden of socioeconomic distress, untreated trauma, and chronic vulnerability that the world has actually, in fact, carried for many generations. The interface between law enforcement and communities as COVID-19 restrictions on mobility, access to paid work or other opportunities and services have further limited individual rights and have come as a shock to many, that conflict between communities and law enforcement. Police brutality, violations of human rights, inappropriate use of force, racism, other biases, violence against the police have demonstrated that law enforcement agencies have not escaped the impact of trauma, with significant negative impact on trust, fear, relationships, and mental wellness, both of law enforcement agencies and law enforcement officials, and on members of the communities that they serve as well. So thus, whereas previously trauma was seen as impacting only so-called vulnerable groups, everyone is vulnerable to the systemic, destabilizing psychosocial impacts of COVID-19. Health burdens, limitations to rights, widespread bereavement and loss, and trauma and economic hardship will further disrupt the development agenda across the globe. If we are to break the disruptive developmental cycle exacerbated by COVID-19, we must support the core of economic health and education rebuilding with resilience interventions for institutions, communities, and individuals to enable them to participate fully and bring the full value of their dynamism and their energy and their resources to the recovery from the crisis, and, as Anna said, to building back better. So we came to, the next conversation that we had was about the notion of knowledge systems, and how we need to think about data, information, and knowledge in the urban safety sector, and how data, information, and knowledge should be used to enable urban safety. We spoke about the fact that data, information, and knowledge are not ends in themselves. And very often knowledge systems, evaluation systems, data systems are kind of operate very independently from urban safety practice. And we had a conversation about trying to shift that to say we need to understand data, information, and knowledge as means to achieving something else. In the case of crime, violence, security, and safety data, information, and knowledge, they're a means to reduce and prevent crime and violence and to promote urban safety. So they are resources which should be managed in such a way that supports the achievement of urban safety. When considered in this light, questions of ownership and access to data, information, and knowledge take on a different light. The value of data and their power to support localized responses to localized problems by local collaborative groups, bringing a range of skills and expertise. So one of the key sort of focus areas there was the notion of having local access to data in time and in such a way that can enable local responsive action. They should be processed through a system which make data, information, and knowledge as useful as possible. This approach provides a useful lens for thinking about monitoring and evaluation, crime statistics, administrative data, adaptive learning, and evidence-led approaches, which should influence the way that these aspects of knowledge systems are built and managed in the urban safety sector. Which brings us to the conversation that we are having today. Anna, I think I should hand back over to you to do the final introduction for this webinar.
Thank you very much. No, thank you, Emma, for the summary. Yes, indeed, we have already said more or less what we want to achieve today. So we are trying to bring back all the four streams of discussion together, and to try to re-promote the systemic approach to make sure that these considerations can be now reunited in something that we can really concretely move forward. In practice, what we want to do, as I mentioned already, is a set of recommendations and something that we can disseminate, starting from the opportunity of the UN Congress on Crime Prevention and Criminal Justice, where we would like to distribute a statement that we are developing. Actually, it's already well advanced, thanks to one of our partners, Sean Tate of APCOF. There is the idea of not stopping here, but basically to keep a live discussion on how these cross-cutting principles can become something applicable and operational from the point of view of programs and concrete initiatives to promote urban safety. I think that with this introduction, we can now move to introducing our panel today. I'm very happy to have here some old friends. And I have a question now for all my panelists. So first, let me introduce them to you, and then I will ask the same question to all of them. So we will go through the list. We have, I don't know if all of them have their video on. I see that there is Elizabeth Cafferty has her video on. Okay, so hello, Elizabeth. Then we have Angela May. She's now on video. Then we have Manasseh Wepundi. He is on video. I don't see Juma Stiago. I don't know if he is around, Juma. And then we have Barbara Holtman from Fixed Africa. Barbara, are you visible? And John Tate from APCOF. If you turn your video on, and if everybody else who is not a panelist, if you can turn your video off, that facilitates, because then we can see the speakers all on the same page. Okay, I'm still missing Uma. Can you please mute yourself? Okay, thank you. Thank you very much, Letitia. Okay, so my first question to all the panelists now is this, that basically I already mentioned that I'm really very happy, very excited to have you all here. You have been listening to the issues that we have been discussing over the past few months. And how does this reflect on your specific interest and area of competence? So what is your immediate reaction, and what do you think that you could be doing, how you could be contributing from your specific area? Let me start with Angela, who is the first I see here. Please.
Hi. Thank you, Anna, and thank you, and good afternoon from at least whoever is in the time zone of the afternoon of you here in Vienna. So it was interesting. I was listening what Emma was suggesting, and you know, when I'm thinking about the word urban safety, I think about two aspects, and one, what resemble to me these things is in relation to the research finding that we have in UNODC, what we have researched and what are the findings in respect to this urban safety. One is what Emma mentioned, the idea of the safety relating to city, and the fact that some city actually can have protective factors compared to the non-city environment. And in fact, we have analyzed, I have to say, in a very simple, some of the cities around the world compared to the national rate of homicide. And then it's clear that for some cities, actually, you see that both in trends and in level, some cities have this protective factor. And particularly, for example, is interesting in Latin America, where we all know, the problem of safety and violence is particularly acute. So I would, say that's definitely something that Anna, you asked, what can we offer from UNODC? So what we can offer from the UNODC from the research side is an analysis to understand some of these issues, to understand and to also alert. Of course, our research findings are very global, regional, macro level, if you want. The way how we can contribute. The second aspect that come to my mind on urban safety is more what in criminology resemble the issue of urban violence, more in relation to community violence. So looking at that violence that is not at home. So the violence that is typically relating to organized crime, gangs, and on that respect, again, looking at what I think we can offer from as an organization is to really see how this type of violence has a much higher impact than what is often measured or understood. And for example, just again, talking about very macro level, in the last 15 years, organized crime has killed as many people as conflict, for example. And while if you think at international level, the focus that is very on conflict, of course, there are implications definitely, that are much further than just the number of victims and deaths. But that's just makes it to reflect on, how much really international organization and the international community really address the impact of organized crime. And so I leave it there, and then hopefully we have the opportunity more to talk about. I heard a lot about the issue of data and analysis, particularly local level, so I hope that we can go back later on that.
Thank you very much, Angela. So sorry, apologies, I didn't introduce Angela. She is the Chief of Research at the UN Office on Drugs and Crime. And so obviously she has a privileged position to deal with all these issues that is very relevant to the work that we are doing. Let's move on. I think I see Manasseh. Manasseh, can I ask you the same question? Manasseh is an old friend, a very good friend. He is a specialist in research and evaluation on peace and security. We have done excellent work in Kenya together, and I know that he has a good grasp of what happens. Please, Manasseh. Microphone, I cannot hear you.
Sorry, I forgot to unmute. But I began by thanking you for this opportunity to participate in this webinar, which I find, the series of which I find extremely exciting. And from a peace building perspective, I would say that among the issues that are of interest to introduce systems thinking. One, that cities are not islands, but that they are a microcosm of the entire society, not only in terms of the diversity of people and cultures that the cities hold, but also in terms of the nature of problems that they introduce. And therefore, for example, from an East African perspective, some of the problems with safety and security in cities are actually problems that emanate from, for example, state collapse. Like Nairobi problems. Safety problems emanate from issues like Somalia, the state collapse in Somalia, and the problem of violent extremism that is informed by the Al-Shabaab group in Somalia. Small arms problems, for example, which inform urban crime dynamics, are not necessarily problems that are rooted in cities, but they are found or they originate from even neighboring countries or even beyond our region. Secondly, that there's also a conceptual issue that if I would discourage to some extent separating some discussions of safety from discussions of peace and conflict. Yeah, because a very good understanding or in-depth analysis of causal factors in issues of urban safety and crime always point back to root causes of conflicts. Yeah, so in some ways, problems of urban safety are about invisible violence, and peace building focuses itself on trying to address some of these deep-rooted structural causes that not only inform conflicts but also inform issues of safety within cities. And lastly, maybe I would say that the webinar series, in a way, the depth of our discussion also, in a way, emphasizes, and for me that's extremely useful, the need to have multi-stakeholder approaches to addressing problems within cities, and they traverse beyond just policing to other issues of inclusion, deradicalization, and so on. Thank you.
Thank you very much. Thank you. Very helpful reflection. Oh, now I also see our last panelist, Juma, has joined us. Good. So we will give him another couple of minutes. I will move to Elizabeth. Elizabeth, another good friend, and she is a specialist in a wide range of issues, moving from public policy and gender, and she has experience in working in delicate environments. So Elizabeth, what does this make you tell us?
Hi, Anna. Thank you for inviting me to join everyone today, and thanks to the other speakers who've given me lots of food for thought already. And Anna, that really wasn't fair that you went outside and you're sitting someplace hot and sunny when I've had rain and sleet and like 25 inches of snow for the past few weeks in New York, but I'll try to ignore that. Cities provide women with both opportunities, but also lots of threats. And so urban safety is something that is incredibly important to women's lives. They can't access all the opportunities that cities have to offer, because most of them feel unsafe. And when you do safety mapping with women, it's very interesting. And it turns you into a sort of amateur infrastructure expert and transportation expert. Because if you think about women who are more often in the informal economy, and they don't have, obviously women have, in general, lower incomes than men. They don't have access to all the resources that men have. And so they really depend on public transportation. They depend on getting around by themselves. but women will move to cities to access better education for their children, more employment opportunities. And again, they can't avail themselves of them when they don't feel safe out in public. And to Manasseh's point, we need to look at the root causes, because gender-based violence is not something that's unique to cities, but is endemic in every culture. And it certainly pre-existed COVID, although interestingly, as women's risk and the incidence of gender-based violence against women and girls has increased exponentially during COVID, it also seems to have, there's been greater focus on it, I think, certainly in the press, social media, mainstream newspapers. Some of that started with the very American Me Too movement, but I think it's definitely gone beyond that. I was certainly part last year of the UN putting out a bunch of policy briefs. Immediately, the Secretary General put support behind us getting messaging out on how you do risk mapping, on how you what actions you should be taking during COVID to try to decrease women and girls' risk of gender-based violence. A lot of it was to do with, and so I just said about women accessing excuse me, urban spaces, but conversely, lots of their risk increased because they were trapped at home and trapped at home with perpetrators. But many of them continued to go out, and we were working with women who, again, for economic reasons, to continue their livelihoods, felt like they needed to leave their home. And so they have less access to the services that they would have been able to access before. And so linked to that, of course, what one would think would be a primary service, the police, providing support to help women who feel unsafe to be able to report. I think everyone knows that women don't report gender-based violence. And that sort of does, of course, differ country to country, city to city, but overall it is a small percentage of sexual violence and gender-based violence that gets reported, particularly to the police. Women are more likely to disclose in a healthcare setting. Many schools certainly that have school nurses will be identifying whether or not children disclose. There's mandated reporting in many cities if you are an educator or a service provider. But again, there might be reasons why mandated reporters don't report, because they don't believe that, same reason that women don't report, which is because they don't believe there are services to protect women and girls. And in fact, if you're familiar with gender-based violence, when you try to leave an abusive situation, your risk goes up of being really badly harmed or murdered by your partner. So what services are there that are available to women and to girls? And how do you make those services available during COVID? And I think, and we'll talk about it more, but a lot of that is what we just discussed, partnerships and partnering with the community and with the police. That is often a challenge because community groups may not trust them. There are often good reasons for that, particularly women's groups. There's questions around who the police represent. Do they represent and are they supportive of the community? Are they really a proxy for a local authority, which may feel or be a dictatorship? In the US, we saw at the Capitol riot insurrection the other week that many of those who participated were former security sector employees. Some of them current, others worked for other forms of the local authority. Also, I think there were some MTA employees, so the Transit Authority in New York, that were immediately fired. So would women and girls feel like they could trust people who are in those positions that have that sort of perspective? And then the last thing I would say before I close these remarks is also what the public messaging police and other security sector engage in. Are you reaching out during COVID? How are you reaching out? What language are you using? And again, going back to a New York example that just happened in the past couple of days, the head of a police union actually used incredibly misogynist, violent language to discuss the previous New York City health commissioner, who was a woman. I won't repeat what he said because it's that bad. So if the head of a police union is not saying something like, I believe the police commissioner was incompetent, or she discriminated against the police, or she misunderstood us, but is actually attacking her with really foul language that disparages women, that's not building trust either.
Wow. Thank you, Elizabeth. Now, thank you very much. We'll go back to all these issues. And Juma, even if you joined late, Juma Sago, he is the global coordinator of the Safer Cities program of UN Habitat. So he is the person who should be really engaging in this type of discussion. And he was involved in our webinar 0, where we started really moving the first steps. So even if you missed our summary, I think that you know a bit more than other panelists what we are discussing. So Juma, the broad question was just, what do you think you can do from your point of view, from your position in terms of moving forward this agenda on global safety? Juma.
Thank you, Anna, and my apologies for joining late after a meeting with Mexico. Yes, indeed, this Change the World webinar series have been quite spot on. And for me, the greater aspect I look at this was the context of looking at urban safety from its implementation lens. A lot of knowledge gathered around the foundational pillars of urban safety in the prevention field. We now know that to address crime and violence in cities, we need to look at the root causes. We need to shift away from the policing alone model to one that really looks at safety as an issue of better urban governance. We have located the city as the nexus in which coordination of collaborative initiatives needs to take place. We also have emphasized the need for a decentralization of security policies to accompany that process, and to ensure that national governments really reinforce the role of local governments in this endeavor. Now, urban safety being what it is, clearly the issue of leadership in cities is a key prerequisite going forward. And as we emphasize partnerships, it's also important for us to say that we have seen from lessons from practice that many cities are unable to sustain their unique, innovative safety practices beyond one lead mayor's term, who was really pragmatic. And so the question of sustainability, knowing that we talk about prevention in the long term, how do we really sustain between and beyond local government administrations? How do we ensure this whole of government, this multi-level governance of safety approach? For UN Habitat, the answers lie first in the systematization of experiences within the city. And when we talk about systematization, it means we have to start looking at cities as laboratories of knowledge, laboratories that can facilitate learning of the immense knowledge that has been gathered over time, to draw out the innovations and come out with the integrated solutions that the new urban agenda and the 2030 agenda for sustainable development are calling. My emphasis will be that changing the world will require us to really focus on the institutionalization of urban safety at the local level, where the citizen is really aided to be the key actor of change, and where the public taxpayers base, the financing of urban safety, is also clearly stipulated in legislation to accompany and to invest in communities to be able to make that co-production of safety and security for all. Accompanying this is the question of measurement and monitoring. We obviously keep talking about this being a very innovative practice, but we do not come to terms with measuring and say, okay, what do we really mean by a safer city? How do we measure that? And what are the agreed set of indicators that a local government's mandate can be able to take forward? That for me and for UN Habitat is where we think urban safety can actually make the change. The final bit is to say that over the years, local governments have also innovated to see that safety, and particularly where there are hotspot areas of safety and safety take place, correspond with other forms of vulnerability in the city. And particularly, we look at the question of natural man-made disasters and the question of tenure insecurity. And so to approach urban safety in its very concrete way and looking at answers, we need also to build solutions that have already been innovated in those other fields, whether through the early warning systems or whether through what is currently in discussion in terms of the climate change adaptations. There are a lot of elements that can be adapted to the context of urban safety, addressing it from the climate balance perspective. Thank you.
Thank you very much. Thank you, Juman. This is quite a lot to digest, but very promising and very exciting ideas. And I'm glad that you mentioned Agenda 2030, because I really was about to say that we have been really rarely mentioning Agenda 2030 during this series of webinars, but we have been talking about really goal 16. We have focused exactly on what is the focus of goal 16 from all its complicated aspects of reducing violence, increasing, strengthening institutions, increasing transparency, increasing accountability. Basically, what we are trying to do here is a sort of a reproduction of all these challenges, and I think that we are coming closer to some of the key questions that may help us advancing in small steps, perhaps, but we are getting there. And I would like now to turn to Barbara Holtman, who is the chair of the Fixed Africa, so one of the partner organizations that co-organized this series of webinars. So Barbara, what is your perception at this stage?
So thank you very much, Anna, and it's very be a part of this this session. I think one of the things that prompted our initial discussions was a sense that and we keep saying it, that a lot of these problems predated the COVID and have just been highlighted and intensified. But that in itself is a really scary concept, because some of the things that we're seeing, particularly as regards to law enforcement, is that burnt out institutions with burnt out service providers, be they police or other law enforcement, are really delivering a service that is not something that good, it's a moment when good people are scared of the police, and in many societies, and that's not a good thing. It's not what we aim for with our police, and certainly here in South Africa, the constitutional mandate of the police does not include making good people fearful. And that the police, I think, for me, the reason that we need to focus so much on the issue of the position of law enforcement in urban safety in particular is because we are now living in a traumatized global world. We probably were for a very long time. and yet we all managed to kind of pretend that we weren't, and that pretense has become a lot harder. And if we look at the police and their levels of trauma, which I think for the first time were received with any kind of empathy or sympathy, was during the impeachment trial last week, where it became almost impossible not to feel overwhelmed for the police who had to deal with that anger, that rage, that sedition, and the racism towards them, and the lack of trust in them, and the assumption that they were party to the corruption and that led them there. And I think that in this whole picture, we need to look at how important it is to not only ensure that the mandates of the different sectors who contribute to urban safety are incredibly carefully defined, not in their silos, but in the integration of them to make urban safety work. And that's a different thing than understanding my mandate on my own. What we're actually looking for is for people who, for all of us to recognize that what COVID has highlighted almost more than anything else is that nothing protects us from the impact of trauma, whoever we are, wherever we are, for the police, if we're communities. In South Africa, I met a policeman shortly after 1994, and he was working in a township here in Johannesburg. And I asked him how it was going with community relations, and he said, the community are okay towards me, but I struggle to be okay towards them, because look at the wounds that I have from when they threw burning rocks at my head. Now, in many societies during COVID, we've seen police be required to uphold new and new restrictive regulations for which they are not prepared, and in which they don't have any kind of tools to actually make it work within a human rights setting and in a healthy way. And so for me, one of the things that's been really interesting in this process has been to look at not only the issues of innovation, that certainly was one of the things that brought Fixed into this because we care so much about issues of innovation and collaboration, but also to be exploring with all the wonderful people that we've been talking with, the barriers to actually making urban safety adopted as embraced as a whole issue, as a systemic issue, rather than seeing it as something in which there's a hierarchy in which the police are the ones responsible for safety. So I think it's for me, you know, that's the motivation, and where I'd love to see us get to is to a point where we are actively and consistently engaged in shifting mindsets about the difference between security and safety, and about the value of safety and the need to flatten that hierarchy between the police and other players in the municipalities, and to build that capability in municipalities, which I know is something that Juma is also very passionate about. Thank you.
Thank you very much, Barbara. Thanks a lot. I think that's okay. We have been talking a lot about the police, and there is a lot of pressure on the police. So who else, if not Sean, who is the director of the African Policing Civilian Oversight Forum, APCOF, and one of the partners to tell us something now. What do you think? What is your reaction now, and how do you think we can really operationalize this process, Sean?
Thanks, Anna. And I think from the previous speakers, the richness of the series of webinars is clearly evident. And the detail is, I mean, we're only starting to unpack it now. What brought me to this conversation initially was reflecting, you know, going into a second year of living within C19 and some of the work that we've been doing. What was the impact of this on the work around safety and crime and violence prevention? Everything that we've been looking at in terms of the practical expressions of some of these programs around crime and violence prevention, the support facilities for young mothers, the aftercare facilities for children, the rehabilitation and creation of the parks and the urban spaces where people could gather and build that social cohesion. All of those seem to be under profound threat in how we managed the pandemic and the transmission of the virus. And what did that mean for us as practitioners? So, you know, for the short term, we had shelters closed down, we had restricted access to police stations, but we're also starting to see the diversion of funds away from this, the massive pressure that's being placed on our non-profit sector, who have provided many of these services, like the services around trauma counseling and public health. What does that mean for this work going forward and its expression? And then if you look at some of the methodologies that we've used, and we've spoken about the collaborations and the partnerships, you know, how do we rethink those partnerships when movement is restricted, when we meet over Zoom or, you know, WebEx or any other facility? How do we build that understanding of each other's role and the need for that cooperation and collaboration going forward? And there are just so many fault lines across this, because you realize that, you know, while it was difficult convening physically in building up a plan towards safety, it is compounded when you think of trying to do that virtually and the unforeseen kind of issues that underpin that, you know, the access to data, you know, people cobbling together the sense required to be able to connect and engage on a platform like this. So for me, it's been really a journey of trying to unpack some of these concerns and issues, and as practitioners to think through, well, what does this mean for us? What does this mean for us in terms of doing things differently? And it's at a practical level, it's at a planning level when we look at kind of cities and safety strategies. And I think there's also at a global level, because what I was struck with around some of the other impacts that this COVID-19 pandemic has had is that there have been a number of treaty bodies and rapporteurs that have been really quick out of the starting blocks around this. And we in ODC, you know, a whole lot of public, you know, what do we ensure that the rights are being held? How do we ensure that our obligation accountability is in place? And I just feel that, you know, as safety practitioners, violence practitioners, what do we do to shore up gains that we made over the decades? And I always kind of refer back to that because guideline kind of really kind of got us into understanding the importance of partnership, government leadership, etc. And reflecting back on that and saying, you know, 10 years down the line, we made significant gains. Are any of those under threat in terms of the current situation? Where do we need to recalibrate? Where do we need to strengthen? Where do we need, as Barbara's completed the innovation to, you know, this process forward? Yes, we do want to build back better. I mean, that's a message. But we're not going to be able to build back in exactly the same way, unfortunately. And this is where I think our collective wisdom becomes really important. And this is what I've really learned from this webinar series and where I would like to see the conversation going. So thanks very much, Anna, for leading this process as well.
Thank you very much. No, thank you. I didn't do anything. I mean, I just planted the seed, and I was very glad that it was a very productive seed. We have a lot of material. I would like really now to go back to each of the invited the guests for today with one specific question. So we have quite a lot of participants here. I understand that some may want to ask questions. So can you please put your questions in the chat, and we will find a way to address them at the right time. So please use the chat to pose questions. So I will go back now to Angela, because definitely we have been talking about data. Everybody virtually has made a reference to data and indicators. And you are in a particular position. You are really in an advantage position. You can see what states are doing with data collection. So my question is really, do you think that they are producing enough? Barbara was launching this very interesting concept of things that we want to see less of. So what you call, you can explain then to us much better what is this about the perverse incentives, etc. And things that we would like to see more of. Do you think that states care about this concept of safety and measuring safety and things that they want to see more of? Angela.
Thank you, Anna. Well, your question, do you think the states care? I think if you ask, and you've seen in many of the polls, if they ask ministries or even if they ask citizens and they say, what do you think is the most important issue? And usually safety comes among the first. So I think definitely, they care. The question is, do they care enough about evidence-based, how you resolve the problem with the evidence, and do they care enough in producing the right set of information and data that can actually help and that to design policies that are effective. That I have to say, let me maybe emphasize a couple of issues where I think we have most of the challenge. I think most states overall, can produce quite regularly. Okay, there's always, on the macro indicators, the homicide. Okay, conflict deaths are always estimated, but you can more or less see, or there's been a lot of investment in the last 20, 30 years on for example, data on violence against women. So the issue is that often this remains at the macro level, and I think the challenge is to understand the importance of granularity of data. And the granularity at geographical level, I think you have been mentioning, and I think Emma at the beginning also mentioned it quite, but others also, the importance of local data. So the granularity that is not at only a national level, subnational, but also a local level. And here I would just mention also what, I'm going back to your question, Anna, what can you offer? What can we, give as a tool? One of the things that we have been really conducting, we are not the only one and we are not the one inventing it, but I just want to mention it, are the safety audits. And I think I want to mention it not only because they are a tool that gives that information at local level, but also that they demonstrate the importance of bringing together different issues in terms of different stakeholders that provide the information. The way how we conduct safety audits involve a lot also citizens. And there is now not only at local level, but at the SDG reporting level, there's a lot of emerging in terms of citizen-generated data. And so at the local level, this becomes even more important. Then the importance of connecting geospatial and statistics. Important that and this is crucial at urban level, because very often the insecurity is clustered, and bringing, as you said, Anna, and that Barbara was saying, what do we want to see more or less? So bringing also something that goes beyond the traditional crime and criminal justice data, to bringing together the social and economic dimension. the geography, so, you know, the involvement of urban architecture, because that is also, you know, there is a lot that importance also the way how you design cities and the impact of a design in city have on security. So to me, the safety audits bring all of these issues together. But I want to also mention another type of granularity that we need to think, and we are not doing enough. One is also thematic. Again, we tend to, you know, stop at how many people were killed, how many people were injured, how many women are affected by partner violence, etc. But I think we need to think about more structuring this data with more information on typology, for example. We have been doing in UNODC, and we are really supporting, and countries are doing more and more. Not enough yet, but more and more, and we see progress. In, for example, describing not only the number of homicide, but the type of homicide, because the way how you prevent gang violence, definitely there are social, economic, common things, but there are things specific that you have to do for gang violence that are differently for violence against women, against children. So it's important that we, you know, we also understand the magnitude. I mean, just to give you an example, for the way how we estimate, with all the caveats, with the, you know, gaps and weakness of data. But for example, in Latin America, you have between 30 to 70% of all of homicide that are relating to organized crime and gangs. This is exactly the same statistics that you have in Europe for interpersonal violence. So, you know, clearly, if you look at Europe, even at macro level, and you see it, the police knows it. You know, if there is an homicide in Europe, typically, you know, the first thing they see is looking at the family, because great percentage of the homicide are related to the interpersonal connection. You go to Latin America, you know, the great percentage, and then the way how you would think about homicide and violence is, you know, more, this doesn't mean it's more relating to organized crime. This does not mean that there is not interpersonal violence in Latin America, by all means. But I'm saying that, you know, to understand the magnitude of these different dynamics is important, not to stop at the number. The other things of the granularity that I think I want to argue for is looking not only at the level of trend of security or insecurity, however, but also the frequency, the you know, the really impact in terms also of the injuries, etc. And I bring this example because it's particularly relevant, for example, during COVID. You know, there's been a lot of talk during COVID, and I think has been also discussed today, how much staying at home orders have affected also the violence against women, and now, you know, domestic violence in general. It's not only women, it's also children. But, you know, when we look at the data, because the data system that we have are mostly relating to number of people. And if you look at the number of people that, for example, were killed by femicide, for example, during COVID, they're not extremely different from what it was before. But where I think we need to look more is at the frequency, and where, and we see now some countries that are discussing this, and, you know, with the hotlines that you see to support victims, etc., is that situations where before COVID, they were vulnerable to violence, they become more violent, they become, you know, extreme violence. But our statistics, our data, they are not captured. They are not now capturing that element. So I think, again, I will make a plea for, you know, going beyond just the total number or just to the level of violence, but really of this granularity. And I want to conclude because to say, how can we do this? One of the instruments that we have, I mentioned the safety audits for the local level. I want to mention, and those of you that have heard me talking about crime statistics, I'm sure they have heard it before. Anna, I think you have heard it so many times. But to me, the helping to go the granularity in terms of thematic is the application of international classification of crime for statistical purposes. And if I have a dream on data on security, is that you know, in the next 20 years, as today, every doctor, when register an event on health, knows very well how to register that event according to the International Classification of Diseases. And because of that, today we have very easily, we know how many people die of any kind of diseases. I wish that this become also for that every policeman, when has to record an event of violence, etc., could, embed the idea of an international classification, so that at all level, because then it goes to every level, local, subnational, national, international, we would really have better knowledge and also in a more real time, because that will become the practice. So that's my dream. I have something about policing, but if there is the time and if you want to later on, because I think it was also an interesting discussion about policing.
Thank you very much. No, thank you, Angela. Of course, we don't have the time now to go into the specialized discussion. That anyway, I think it's something that may be worth spending a couple of words, because it connects well with the discussion on policing that we had. So maybe if in training of the police there was sufficient attention and time devoted to the importance of data recording, that instead generally police rank data collection very, very low, and that is also why the administrative data that we have are so poor. Maybe that would be a very good investment. So maybe that is something that we can note in our follow-up observations. And thank you also for talking about the granularity, because this is definitely something that lacks at the top level. But from your position, as you said, you have been able so far successfully, and I hope that you will continue engaging states on the importance of these things and talking to them about the need to measure, etc. So thank you, Angela. Thank you very much. I think that I would like to continue in a way with Elizabeth, because Elizabeth brings this special experience of the gender aspects and some good practices that she may share with us. So Elizabeth, can I give you the floor to talk more about the experience that you can share us, and also telling us a bit more of what you already started saying at the beginning. Thank you.
Sure, thanks. I think I'm going to also, comment on some of Barbara and Angela's remarks, which I found really interesting and agreed with. Barbara was talking about the fact that urban safety and security should not just be a police issue, and I could not agree more. There needs to be a whole of the government approach to it. There also needs to be a whole of the community approach to it. And I think that looking at it from that perspective, that it is not down to one department to implement this, to track it, to have accountability for it, means that we will actually be able to realize it. I think a lot of the problems that we're having is because I think, she talked about the trauma that everyone is feeling, and including the security sector. And this is something that they can't just handle on their own. And I started speaking about partnerships before, and partnerships with, in terms of women, good practice would be partnerships with community groups, consulting women and young women directly as much as possible. In many of the places where the UN works, in many cities, community leaders and groups have lots of excuses about why women can or should be not directly communicated with or consulted. And this is very much, I spent lots of time arguing that this is a human rights issue. And if there's cultural constraints that mean women have to, there's always a way to talk to women. Some strategies getting around cultural issues is making sure that there are always women present when women are being consulted. And frankly, you should do that anyway, because women are more likely to feel comfortable if they're not just speaking to a group of men, but also speaking to a mixed group, so women and men. I did lots of work with UN. When I was in UN peacekeeping, I worked a lot with the police and the military components and the gender advisors there. And we put out a book on how you apply gender equality and the Women, Peace, and Security agenda in peacekeeping missions. How do you apply a gender lens to policing? How do you do that in military activities? Part of it is recruiting more women. Part of it is putting women in positions of authority, of responsibility, getting women out there to help you engage with community. But we were also very clear that it shouldn't just be women police officers or military's responsibility to talk to the community. So don't stereotype women as having these, you know, special communication skills that men don't, because that's obviously not true. But get them out there in mixed teams and having pairs of officers, particularly when you're dealing with situations of gender-based violence. You know, many different police departments in different countries, there will be women's desks when you go, if you want to report to the police. This is another way of encouraging women to report, making women feel secure. And so that is certainly a good practice. Angela's comments about healthcare workers. I've done a lot of global health research looking at gender-based violence, and this is one of the things that we were trying to get all sorts of healthcare practitioners to screen for, particularly with girls, where this might be, you know, again, I mentioned school nurses. This might be the only opportunity where there is someone who might be able to identify someone who is at risk. And certainly the services that are offered in cities that actually have public healthcare infrastructure, there is more opportunity to help refer girls to services. Also understanding when you're referring a woman for, or a young woman for services, that not all women, as I mentioned this before, want to disclose to the police. And so making it clear that this is her right, but this is not a requirement. And another thing that the law enforcement has done in a number of cities to help build trust is that women don't necessarily have to be part of the process all the way. They've reported something, but they don't necessarily have to be there, and that men, because men are the majority of perpetrators, can be prosecuted nonetheless. That's certainly the UN's perspective when it deals with sexual exploitation and abuse, which is something else that would be a whole other seminar, which of course is when it's not just police and military, but people in positions of power, humanitarian aid workers are sexually abusing women, that once the complaint has been made, that the investigation will go forward, regardless of whether she cooperates. And it may be well that she's kept safe that way. I need to wrap up in a second. I just wanted to also mention Angela's points on data. I think over the past 10 to 15 years, there's been an obsession with quantitative data and big data, and that this is the idea that this is going to solve all of our problems. And as someone with a social science background, I can't stand that idea. And I think that what Angela was speaking to, I see Barbara's comment too, was helping to break that down, saying, you know, ask lots of questions. When you get a number, whether or not, you know, you're like, oh yes, of course, or you're surprised by it, just ask lots more questions. Like, break things down. Don't just use that aggregate number, and also talk to people. So you really want to have this qualitative data alongside the numbers, and that's going to make the better understanding. And I also just want to make sure, because I've been talking about, you know, violence against women, violence against girls, as if, oh, there was an echo. I hope you guys can't hear that. As if women don't have any autonomy or agency. But I have mentioned that they're women's groups and that they need to be partners. And no matter what city you're working in, you know, I've often been asked, oh, in really difficult circumstances, like, you know, where there is live conflict and disasters, if you're working in Kabul, or if you're working someplace deep in Myanmar, you know, what can you possibly do to consult women? There's always women's groups, no matter how restrictive a society, oppressive or misogynist or patriarchal. There are always women's groups who are in touch with women. They're often underground, they're often doing it in a low-key way, but they're always there for you to consult with and to work with. And so I think maybe I'll wrap up by saying, and part of the way to sort of overcome what you may feel is a negative stereotype that, again, the security sector or police in particular might suffer when perhaps that's something that was true in the past, but no longer true because you've gone through lots of police reform efforts. Do think about your messaging. Do think about who and how you're conveying your messaging. And when you are trying to build trust with women, think about that power structure and position yourselves more as partners rather than you are the authority and you are there to sort of help them. And I think that will help build, along with, accountability measures and transparency, but looking at how you build an equitable relationship with partners who, for very many good reasons, may not have had trust with your institutions in the past. I think that's critical to build safety going forward.
Thank you. No, thank you very much. You made a lot of interesting points. So I ran out of paper. I was writing on my phone. Elizabeth, this is very interesting also for us to connect with the issue you mentioned Afghanistan, you mentioned very insecure places, and Manasseh mentioned earlier that it's important to link the discussion on safety to peace and conflict. So I would continue this with Manasseh, to asking him to elaborate a bit on this, and just to tell us how can we operationalize this. Before I give you the floor, I see that there is a hand raised by Barbara. Is this 2 fingers on something?
No, I wanted to respond very directly to Elizabeth very, very, very immediately. And to say that one of the things that I think we should be measuring is a pathway towards a place where women are no longer regarded as vulnerable because they are women. And I think that's something we need more of. So your point about agency, your point about women not necessarily having to be victims, I think is an absolutely essential one. And maybe if we think about it like that, and I mean, obviously from our point of view, we always think about it in terms of what does it look like when it's fixed? It is that instead of us always having to adapt into or try and squeeze ourselves into safety strategies and messaging and all the rest of it, from a perspective that where women are then brought in as a vulnerable group, what you're saying about women's groups existing and working everywhere, women are an asset. And for me, the continuum for this needs to be from women are victims to women recognized as assets, and that it's no longer an asset in a man's world. So for me, I think there needs to be a very strongly feminist perspective on shifting the way that we think about women and safety. And I really liked a lot of what you said. So thank you very much.
Thank you, Barbara. Thank you for the clarification. I think that I don't know, Angela and I, we are Italians. We are witnessing an interesting phenomenon in Italy with politics, with the shifting. So that basically now you see the Italian government is all males. So where have women gone? They have forgotten about the famous feminist positions of many of the parties. Women have disappeared. Anyway, so this is always important to be said and to be reminded. So Manasseh, can I go back to you, really specifically to elaborate a bit further on this connecting safety and peace and conflict, and how do you think that communities can really heal from the pandemic, from these effects that we have been hearing about, lost capacity to react and to respond, services that have been reduced, and poverty that has increased. Thank you, Manasseh.
Okay, thank you. Maybe I'll start by talking about in the pre-pandemic period. There's been a lot of evolution of, for example, conflict prevention platforms. For the most part called early warning and early response platforms. These had and have grown in number and complexity. There are those that are, generally focused on conflict, but you have platforms that also just exclusively look at, for example, gender-based violence and their incidents. So, and issues with violent extremism. So these platforms develop tools and indicators around which the context is monitored for, for those alerts. I would think that's one big entry point for issues to do with urban safety. Because one, while these platforms have grown in complexity and, like for example, from paper-based data monitoring to online and mobile phone-based transmission of alerts, they've grown in this complexity, but there's very little interlinkage between the various platforms across thematic areas of focus. Now, if we are talking about how issues to do with urban safety are also issues to do with root causes of conflict, then therefore it means that the interlinkages are especially important now. And we know that in some regions like ours, these conflict prevention platforms have been codified into regional instruments. Like we have the Eastern African Intergovernmental Organization called IGAD, the Intergovernmental Authority on Development, that already has a protocol on early warning, on conflict early warning and early response, and has even another protocol on establishing the Center of Excellence on countering violent extremism. And the both institutions, so the conflict early warning and early response mechanism and the IGAD Center of Excellence for preventing and countering violent extremism, the both of them actually monitoring, collecting data that monitors trends either in conflict for C1 and or in violent extremism for the one that is focused on violent extremism. Here in Kenya, we even at some point had the UN Women come up with an early warning mechanism for monitoring, especially issues relating to women, mostly gender-based violence, but any incidents of electoral violence that relates to women or to issues to do with women's rights. So that becomes an opportunity for perhaps, because the platforms are evolving and improving, for improving them further to also just better covering issues to do with urban safety. But closely related to that, and I think I'll tie that to the conversation about the issue of macro level data and how important granular data is. By saying that, we have especially opportunities through non-state actors who largely have rich data, only restricted by probably geographical scope, depending on which areas of focus they have. But the data is present among these non-state actors. And these non-state actors have been improving their collaborations with governmental institutions. Only that data sharing, has been problematic either way. Either from the state actors to civil society actors, or from civil society actors to the state actors. Yeah. So the problem for non-state actors would be that a lot of their data is donor-driven and intervention-driven. So depending on the nature of intervention they're running, then they will have lots of rich monitoring data on those issues, but that monitoring data is only of use to the civil society actors or to the donors who would need reports on the same. So we perhaps might need a model that sort of makes it possible for both state and non-state actors to share data that is of public good, that should be, by public good, I would say in them, it would mean data that should help improve policing or improve safety in the urban settings and the like. On another point, I'll talk about, I found some good in the incidence of political violence in the United States. Yeah, that there was some good in it. And the good in it is that these are experiences that are very common to a lot of other countries. And that, Kenya is notorious for that, electoral violence. Uganda only recently in this pandemic period also had quite a bit of state-sponsored violence. And a lot of this violence is not just about disorienting the rural heartlands of these countries, but as the Americans experience it also disorients cities. And therefore, I would say that the politics of our societies should be of interest in terms of monitoring the risk factors that come with elections. And we see that elite conflicts, disagreements among political elites, across partisan lines, has a real impact on the lives of people, not only in cities but across the country. Onto your question about healing communities affected by the pandemic, or suffering from mental health consequences of the pandemic. I would say that the very foundational need would be to, first of all, probably we need a lot of studies across, many cities and many countries about the depth of the consequences that have been experienced. Anecdotally, we know that, there are many lives lost, many lost. In places like Kenya, there was an upsurge in issues of domestic violence during the lockdown period, over the pandemic. Also in Kenya, with the schools closed, parents realized that students, their children, were also a handful. There was a lot of deviant behavior. Quite some reports around childhood pregnancies during the lockdown period. I think we need a very systematic and comprehensive understanding of the breadth of these consequences. On a personal level, I would say the pandemic actually, for example, I was separated from my wife. She was in South Africa, I was in Kenya for 7 months. So we didn't see each other for 7 months until the restrictions were eased, and then she was able to travel. So so there's a whole breadth of them, and they need as a first step to be comprehensively understood, because it's a fairly fresh experience for all of us. But I would also say that the thing about cities is that they represent development, but they also represent an erasure of communal life. Yet communal life helps with longevity. That the more communal we are, the healthier we are mentally, and the longer we live. Therefore, so in the pandemic actually emphasized that point about how individualized lives are in cities, but also that also emphasized that that individualism, that separate existence, contributes to stresses upon our lives that need to be addressed. Now, individualism in an urban setting is bad, but there are ways that can be realized. For example, we have local architecture that present opportunities for connection, social connection, and intergroup support or interpersonal support. A good example, for example, in civil society actors that focus on HIV in Kenya have support groups, and these they form a basis for, and have always formed a basis for, these people living with HIV to offer support to each other through the years, and it has become a basis for them to confront issues of mental health and to just live connected lives amongst themselves as people living with HIV. Now, this of course can be replicated to have sorts of support groups in some societies, especially that are strained by issues of mental health or the consequences of mental health. A second idea would be around having social protection mechanisms. I think governments, like the Kenya government, has had some sort of cash transfer intervention that was offered to especially needy communities that registered with local authorities. So more of those, I think, would be useful in the context of lost jobs. There is also a good example that I came across in a part of a low-income estate in Nairobi called Kibera, where it's about social insurance, where the low-income residents came together and actually took out a policy, enrolled for a policy, an insurance policy that became of use. They lost a member, and that's how I learned about it. They lost a member in the group and did not have to spend much to transport the body from Nairobi to the rural areas for the burial. Why? Because the insurance company was able to pay up for that. So I think a lot of awareness around what available social protection mechanisms would be useful for healing communities. Another approach that we found worked through especially interactions with journalists, and these journalists were mostly in the local broadcast media. We encourage them to embrace the possibility of faith-based approaches. Where we encourage them to to broadcast church services to Christian communities, and in some cases for the Muslim groups, they also had some broadcasts for that, as a way of plugging in. When the government talked about restriction of movement and restriction of crowds, there was quite a bit of resistance to the notion of closing down churches. Now with the broadcasting of some of these services, the spiritual or Christian or religious communities were reached without having to flout the restrictions. So I'm saying that faith-based approaches are also extremely useful, especially for communities that are extremely religious. And Kenya is predominantly religious, I would say. Yeah. So, and then a last point. I'll talk about how official responses, where they've been part of the problem, to evolve. Yeah, the early periods of the pandemic, the experience in Kenya was not very good, in the sense that there was near criminalization of COVID in the way the government enforced restrictions. Some of those restrictions were violent. In Mombasa, a coastal city in Kenya, there was one controversial incident where police flogged people for not being home early, and yet the people were actually rushing to go home, in the first place. So that criminalization kind of contributed to stigmatization of anyone that got infected with COVID. So that, and then therefore complicated a response to those people. I mean, offering care to those people who got infected, and the stigma, while it's fading, it's still an issue. So I think evolution of these approaches, official approaches in response to the pandemic, are also necessary. Thank you.
Thank you very much. So actually, this is a confirmation of some of the things that we were considering as obstacles at the beginning, but indeed they are there. And so thank you also for giving us some concrete examples of these obstacles. And so this brings us back to Juma. Now, after you have been listening to this, I think that the issue of partnerships that you raised is more and more important, and we have put on the table quite a lot of elements. So Juma, what can you tell us? What can we do? I know that Barbara likes to use this approach. So there are three things that we can do. We can throw away what doesn't work. We can fix what can be fixed, and we have to create something from scratch. So what do you think, Juma? Is there anything that inspires you in this approach?
Yes, very much. I think the real point is about how we activate and sustain partnerships. And if we focus on that aspect of activating and sustaining partnerships at the local level, then we begin to start aligning our inclusive methodologies with the way the functions and the systems of local government, in terms of urban planning, in terms of urban legislation and urban financing. Unless we begin to look at our inclusive methodologies from a systemic perspective, and to ensure that they are aligned with the way government delivers at the neighborhood level in terms of housing, infrastructure, and basic services, then urban safety will continue to struggle in terms of how we look at the co-production of safety and security for all. As we say, co-production of safety and security for all is a fundamental part of an urban safety strategy. And given that it is process-oriented, it amplifies the role of local leadership, and including the citizens as the key actors. So if we take into consideration the wide range of stakeholders and the diverse perspectives they bring, that really build on what our previous speakers have spoken to, the evidence of the causation of crime and violence, then we need to establish partnerships between levels of government, of course, and between authorities, community organizations, non-government organizations, the business sector, and citizens themselves, including the most excluded. So local authorities are really the key anchor that we need to really build in the question of also the local governance of safety, which implies to me examining the governance structures of the city as a catalyst to what I call collective and collaborative action. If we center the conversation around local governance as opposed to just local government, then we bring in the possibilities of and capacities of other local stakeholders, while empowering local governments to coordinate the coalition of local stakeholders. We need to build in participation of other stakeholders through those inclusive methodologies that we have spoken about, and ensure that we are actually making inclusion actionable. So local government has key tools such as participatory planning tools or participatory budgeting tools. How do we see urban safety financing around this perspective? How do we see urban safety legislation around this? How do we really build the pacts between those communities that are actually innovating change with the way financing is public financing is actually delivered at the local level? These are questions of sustainability for urban safety. And unless we think of urban safety requiring financial investments of national, state, and local governments to support those effective, support and sustain those effective partnerships at the local level, we will keep jumping the gun where it concerns the delivery of urban safety from a perspective of co-designing, having citizens being at the table to co-design those safety strategies for all. Now, COVID-19 has really given us an opportunity also to build back better. And I think we have understood the ways and the messaging that has come with COVID-19 in terms of really building in each one to be the neighbor's keeper. And I think safety, the co-production of safety and security can ride on that crest and be able to find itself getting more institutionalized in a progressive realization on the ground. I saw on the chart the question of should we build guidelines on partnerships. I would say we already have essentially as many tools, inclusive methodologies already developed. The question is about alignment. And the system-wide, UN system-wide guidelines on safer cities and human settlements is really calling on us to focus on those key successful implementation mechanisms that cities have developed with citizens around the world. If we can document those more and ensure that those are aligned with measurement and monitoring, then I am sure we will begin to start seeing the ways in which we can actualize, activate, and sustain citizens' active work with cities, and also building in the police as a complementary actor, building in the legitimacy of policing as the real actor that any local governance of safety framework requires to have.
Thank you very much, Juma. Thank you. It may be very complicated issue of putting together different stakeholders who may be already doing things that are very relevant for the work of each other, but they don't talk to each other yet. So a little bit what Manasa mentioned, that there is a production of data that is sort of very limited in scope and in dissemination, because it's limited to the specific use. I have a lot of expectations now for an activity that, Angela, I think it's your office that is coordinating the measurement of some indicators for goal 16 via surveys. No, yes, that could be a good development that may also have some implications. I don't know if you want to say just 2 words on this, because then we wrap up with the chat, that there is a lot of interesting things in the chat.
No, I think, as you say, I think it's an example also partnership, because we're doing this with different agencies, the Human Rights Agency, UNDP, us. So that's is an example. And indeed, as you say, is a consolidated model that could be used also at a local level, by the way, with local surveys. So, and then incorporate all the aspects, I think, of security.
No, thank you. This is one example of something that can be used, a concrete tool. I have seen quite a lot of comments and questions in the chat, and may I ask Emma to summarize what has been happening in the chat? Thank you.
Sure, thanks, Anna. I'm just coming firstly to the last comment on. So it was actually a question in the chat posed by me about the possibility for international global guidelines on partnerships and collaboration. And Juma was saying, you know, these practices and approaches already exist, and so we don't really need to kind of reinvent them. And Barbara was responding to say that although many of these practices exist and are widely accessible, relationships still fall apart. And she makes the point that it's often small personal slights and unintended harms that cause the breakdown of relationships that are intended to deliver systemic policy and practices. But I think I'm just, because I'm a facilitator of collaboration and partnerships, I really want to see this prioritized. We've also seen in the chat some about, Barbara also mentioned the notion of pathways to safety. So Angela was talking about environmental design and other types of interventions which go beyond sort of simply responding to crime and violence. And Barbara posted a lovely quote from our colleague, Professor Doris Summer, who says, people are dynamic. We can try and control that dynamism, or we can offer opportunities for that dynamism to be a powerful, creative, and inclusive social participation in the vibrance of our urban spaces. Which is really, I think, just to say, we've learned a lot from Doris about being a lot more radical about what we regard as interventions that would impact safety, and to be very inclusive about those. Then we had a post from a colleague in Nepal who's shared some information about a school and media, two organizations, and there are website links there for anybody who would be interested to work on anti-corruption interventions, network building, grassroots work, community work with young people. Then there was some discussion about the collection of data by the police. And it was actually in conversation with one of the participants, one of the speakers from our previous webinar, that we were talking about whether the police are really the right people to be gathering all of the information, for example, about gender-based violence. If a police person is called into a situation, an emergency or crisis situation in a home, and has to prioritize, you know, what actions and what steps to take, then perhaps he or she isn't the right person to be collecting data. And so there was some discussion that's unfolded about that around, well, detectives, for example, are people who are trained to and who are gathering information. And so, but also that there could be the possibility of other types of follow-up after police intervention in emergency or crisis situations. And also the notion that there's lots of support here in the chat for broadening the types of data, for being more diverse and inclusive, but also, of course, the kind of the the risk that we need to be very careful about qualitative data as well. We need to make sure that we regard it in the same way as we have to treat quantitative data as has to be valid and credible and accessible. We have to do, we have to have the same kind of measures in place to ensure that we are comfortable with the way that we interact with qualitative data. And then Thomas has made 2 points. Firstly, participating in the discussion about who collects data, sorry. And then the second one was in response to Manasseh's discussion about the status of the relationship between the police and communities in Kenya, and saying it speaks to the broader theme of how the criminal justice system, in terms of regulations and how they're framed and how people understand them, as well as the way that they're enforced, so the reputation of law enforcement agencies, can directly contribute to public perceptions of the legitimacy of criminal justice system, legitimacy of law enforcement structures and systems as well. So really important not only to be thinking about the content of our laws, but also the way that they are perceived, or not only the content of the way that police conduct themselves, but also the way that they are perceived. And then I've left the most surprising comment for last, which came from Addy, and he said he's not sure that using women in different positions in the police or the military would result in better efforts to reduce crime. And Elizabeth has given a few examples, just a couple of examples of the significant research that demonstrates that in all sectors, diverse teams, meaning teams with greater parity between women and men, and with people from different backgrounds, leads to more effective outcomes. So that's kind of a general comment on the notion of diverse teams, but then there are also other comments on why it is really important to have women working in spaces, particularly in relation to the needs of women and women's vulnerability, but of course also issues around sexual harassment and assault in workplaces. So that was a little bit of a surprising debate. And then I see that there are some comments here that have come up just while I've been talking. Juma, I see that these are comments that have come from you. I don't know if I should perhaps hand over to you to summarize them instead of trying to do that myself, since I haven't had a chance to read them yet.
I was just responding to Barbara and saying that maybe the framing of a monitoring tool as an advocacy and accountability tool can be at the center of how we shape real partnerships between communities and local government, where local governments are the facilitators, but we actually build on what communities are actually doing to activate, to really deliver safety. And of course, bringing in the police also at the center of those conversations. So maybe it is really around a monitoring tool now at the city level, building in on what already exists in terms of local observatories that can be at the center of how we think of activating and sustaining partnerships. That's what I mean.
Sorry, Anna, there was one thing that I forgot to mention. So thanks, Juma, and that's also a response to a conversation that I was kind of moving towards. So I think that that's a really powerful response, especially in light of the discussion that we've had about system, about the importance of data following the approaches that we want to advocate for. But the other thing that I just wanted to very briefly mention was that mention was made in the chat of crime observatories as an alternative and a support to police capturing of data and to analysis of administrative and crime statistics and data. And so that was just something that I had neglected to mention, and something which is obviously very important as well. Thanks, Anna.
Thank you very much, Emma. Thank you for the synthesis. I see that perhaps there are a couple of new comments now at the end, but we are going to save the chat, so it's going to be accessible. Most probably, I don't know exactly how, but perhaps Tobias can tell us. And okay, we are actually 2 minutes from the end. I am really full of ideas, and I wish really to thank everybody for this very interesting discussion. I don't know if there is any very last minute comment from any of the panelists. If you want to say something, Barbara, Sean, Angela, Elizabeth, Juma.
I'll come in with a very brief comment. I was reading those comments in the chat, and I was interested in the fact that the comment on the monitoring tool came after the comment on the need for increased funding support for local communities. And I think those two can be tied together, so that there is a kind of imperative to recognize that there is going to be deficits, and we're going to need to support that in terms of our efforts around prevention and safety. But that we could tie that with some sophisticated monitoring that can bring local governments and communities together in terms of how that is spent and how it is, and the outcomes that are achieved.
Very good, thank you. Now, I don't know, Juma, if your hand was goodbye or you wanted to add something.
No, you know, in these days of COVID, you battle between this and homeschooling and home everything. So I have the boys here trying to tell me many things.
So hi to the boys. Welcome to the group. Yeah, yes, thank you very much. Barbara, you want to add something?
Yeah, I think just, you know, that coming back again to that issue of diversity that was raised in the chat, that women should not just be there for women. The assumption that having a woman in a particular place brings a particular set of characteristics is completely, I think, flawed. Women are not a homogenous group and bring an entire range of skills. And so to decide whether or not women are useful in any setting is to ignore the 50%, or in case of South Africa, the 54% of women who bring, you know, who bring skills of every kind you could possibly need in any setting. So for me to decide that women should not participate in some particular role is something that I would, my feminist self says, no. We've got to move away from that. Otherwise, just to say thank you so much. Really enjoyed today and the other seminars. And thank you to everybody who has participated. It's been really great, and I really hope it's the beginning of a journey, not the end of one. So thank you, and thank you so much, Anna.
Thank you very much.
Thank you very much.
Thank you also, Angela says she has to go. Thank you, Elizabeth. Thank you, Manasseh. Thank you, Juma. And thank you to the co-organizers. It's been a really very exciting journey. We have a lot to do, so let's get together soon to continue the discussion. Thank you, everybody, and we'll be in touch. Bye. Bye-bye.